Good afternoon and welcome to this edition of St. E Talks, Pharmacy Techs Meet the Patients. I'm Angela Lepasnik and I am the tech supervisor here at the Edgewood location. I am involved in the day-to-day operations of the technician assignments. My career here has spanned 26 years, and that includes working at Fort Thomas, Florence, and Edgewood. I began as a Tech 1, moving through the years to a Tech 2, a Tech 3, and finally I was promoted to a Tech Supervisor about 2 years ago. The reason I've stayed with St. Elizabeth in part is due to the flexible schedule. St. E's provided me the ability to have a career as well as providing for my family. Throughout the years, I've had the ability to change shifts to meet the needs of my family at home, and for that, I'm grateful. St. Elizabeth is an all-around family atmosphere where our associates do things outside of work and they forge long-lasting friendships. Our pharmacy techs here play a vital role in caring for our patients, and I'm going to talk to several of our technicians and let them explain their different roles in the pharmacy. So let's get started with Erin Smith. Erin's a certified pharmacy tech 3. Hi, Erin.
Hi, Angela.
So Erin, how did you begin your career in pharmacy, and why have you stayed in the profession as long as you have?
Like she said, my name is Erin Smith. I began my pharmacy career with a retail chain in 1996 while I was going to school at Thomas More University. When I was presented with an opportunity to work here at St. Elizabeth, I jumped at the chance and I didn't hesitate. I was hired in 2004 before the 7-floor tower building was even complete. And once this opened, I don't think we've ever looked back after that. There are several reasons why I've stayed here in our pharmacy department. One being I really enjoy working in our IV rooms here at St. Elizabeth. It is such an important responsibility taking care of our patients in this challenging way. Another is my coworkers here. I just love them. We've shared so many more things than just work days here. We share birthdays, anniversaries, and many other milestones here together. And finally, one of the most important things, like Angela talked about, was being that we have such a versatile work schedule, and that me being the mother of 2 kids, really valuing my family time in this job has been enabling me to work in this area for almost 17 years now. So, and these are some of the reasons why my career here at St. Elizabeth has been so rewarding for me.
Yeah, I have to say the flexible schedule is one of the perks.
Yes.
One of your areas of expertise here in the pharmacy is staffing and training in our sterile compounding IV room. Can you talk about the scope of that area and what knowledge could new employees expect from gaining to work here?
Yes. As I touched on earlier, I mainly staff and frequently train in our IV rooms here at St. Elizabeth, which is one of the most critical areas of our pharmacy department. Our staff takes care of the patient's IV medications in a timely and efficient manner. Another aspect is our IV rooms are equipped with state-of-the-art sterile prep compounding programs, which utilize photography and gravimetrics with the utmost of accuracy and efficiency. I also work in our cancer care facility, making the most precise compounds there are in pharmacy. And when I talk about sterile compounding, for those who are unfamiliar, it's creating a medication in an environment free of viruses, infectious organisms, and other bacterias, essentially a clean room. And some examples might be IV injections that we make, infusions, medications for the eye. And it's almost like sort of following a recipe for making a cake. But in this case, we're using dextrose and saline bags and needles and syringes. And new technicians can anticipate learning these programs that I was talking about, and also the art of sterile technique, which is a vital area of our pharmacy. And if this sounds interesting to you, there's many more opportunities here at St. Elizabeth, so apply in our pharmacy department. I'd be happy to see you. Thank you,
Great.
Angela, for letting me talk today.
Oh, you're welcome. You are one of our IV experts, so thanks for all the great detail.
Thank you.
Our next guest is Sarah Bryson, lead pharmacy tech. Hi, Sarah.
Hi, Angela.
So, Sarah, can you tell me what motivates you to go to work each day?
Yeah, so just kind of simply put, it's the patients that I get to work with. So like you said, I specifically work in the cancer care pharmacy, which is a very unique area of the hospital. Our pharmacy allows us to meet the needs of the different oncology patients that we see who visit the cancer care center. We're able to assist the patients from start to finish. We have a great communication with their care team. We submit their prior authorizations for any medications that may need that. We are also even able to deliver their medications to the patients while they're receiving treatment, so they don't have to stop down at the pharmacy on the way home, either down here in our pharmacy, or if they typically feel somewhere else, we're able to get it up there to them. We also keep specific over-the-counter medications in stock for our oncology patients, and we're just able to build that really unique relationship with them. Makes it, really special.
Yeah, great. Thanks for telling us everything you do. Can you tell me, how did you get into your position?
Yeah, so I began my career at St. Elizabeth as a discharge medication delivery technician. Within that role, I helped to deliver medications to the bedside as patients were being discharged from various units on the hospital. My husband took a new position in Lexington, so we moved away for a year. And when we returned back home to Northern Kentucky, I didn't really hesitate to come back to St. Elizabeth just because I knew about all the different growth opportunities and how they invest in their employees. Like you said, my current role is the lead technician in cancer care. Within this role, I help the patients in terms of getting their medications to them. I also help with daily operations, workflow, scheduling, and inventory here. And I really truly enjoy just being here and look forward to the growth that's still going on here in the pharmacy.
Great. We're glad that you decided to come back.
Thanks.
All right, next we are going to talk to Madison Buskin. Hi, Madison.
Hello.
So can you tell us what the educational requirements to work as a pharmacy technician?
Yeah, so luckily within St. Elizabeth, they do provide all the training that is needed for pharmacy technicians to really excel in their specific area that they chose to focus on. After the technician feels like they have the adequate training and knowledge, they are then able to take the National Certification Exam for Pharmacy Technicians. So this test really focuses on all areas of pharmacy and can help the technicians expand their knowledge in pharmacy and be the best in their role.
Great. Can you share how working at St. Elizabeth has changed your life?
Yeah, so prior to being with St. Elizabeth, I looked at pharmacy just as a normal job. And since I started this position at St. Elizabeth, I really look at it as my career. I have learned so much about all the different areas of pharmacy just within the health system. And I have been encouraged by my leadership to really find what I like and to move up in that area. And within St. Elizabeth, I also feel like I'm not only bettering myself by learning all these different areas, but I'm continuing to give back to the community just with all that St. Elizabeth does.
Great. Thank you, Madison.
Thank you.
Next, we're going to talk to Erica Kiley, Certified Pharmacy Tech 1. Hi, Erica.
Hi, Angela.
Could you please share your training and experience at St. Elizabeth Healthcare?
My training experience here has been excellent with all of my coworkers. Through the beginning, everyone was really patient, kind, and just really detail-oriented during the entire process of training. Working here at a hospital pharmacy is much different than working at your just local Walgreens. I myself have just expanded my knowledge so far. It's insane. Just because we have like the IV room, sterile compounding in there, we have the non-sterile compounding, the OR satellite, and then the cancer care pharmacy. It's just endless areas to train here.
Yeah, we certainly have a lot of different opportunities. What would you tell pharmacy techs who are considering a change and applying for our pharmacy tech position?
I would definitely tell them that it's very rewarding to work here, and there is competitive pay when coming here compared to other locations or other pharmacies around the area. And just if you're not wanting to really look or go to college and spend years and years there learning something, another trade, I would definitely just come here because it's a great community. You're giving back to the community, and you can meet so many friends and family members here and just really grow as a person.
Great, thanks, Erica.
Mm-hmm.
Now we're going to talk to Joanne Kohler, Advanced Pharmacy Technician. Hi, Joanna.
Hi, Angela.
So, if you could tell me what differences there are maybe working at St. Elizabeth versus your other employers?
Sure, absolutely. Working at St. Elizabeth, I feel like the biggest difference between the two is the attention that we can give to patient care. At all my past positions, it was really encouraged just to focus on metrics, numbers, and how many prescriptions we could get out the door. At St. Elizabeth, my job really revolves around the care of the patient and allows us to get to know our patients on a more personal level. At the specialty pharmacy, we actually go out of our way to customize our calls, and we take extra steps to ensure that refills are processed according to a specific patient's needs. The previous jobs, I never felt this was something that we could accommodate, but at St. Elizabeth, we do it every single day. It sounds a little silly, but the specialty pharmacy actually sent out Christmas cards to all of our patients as a token of appreciation that had pictures of all the technicians and pharmacists on it. St. Elizabeth gives us time and resources to provide that level of care to the patients that they deserve.
That's awesome to hear. If you could offer one piece of advice to someone considering a career at St. Elizabeth or in the pharmacy, what would it be?
I think the biggest piece of advice when starting at St. Elizabeth or any pharmacy is that you would need to seek out the growth opportunities and don't remain status quo. Here at St. Elizabeth, there's a lot of training opportunities, a lot of different certifications that allow the associates to develop. They truly invest time and energy within their people to allow them to expand their knowledge in all the different areas. One thing that I also really enjoy about St. Elizabeth is that we have monthly one-on-ones with our leadership. And at that time, we get and give feedback and different ideas can be heard. So I feel like we really do have a voice amongst leadership. It's something that's definitely unique to St. Elizabeth.
Right. I think that feedback is awesome, having had that opportunity here in the hospital.
Yes.
Thank you.
Uh-huh.
All right. Next, we're going to talk with Josie Mullins, Certified Pharmacy Tech 3. Hi, Josie.
Hi.
So, Josie, can you, so there's a lot of opportunity for pharmacy tech positions. Why have you stayed working with St. Elizabeth?
Because I feel like I could make a difference at St. Elizabeth. I've been fulfilled working here because of our patients and our coworkers, staff, the nurses, to the housekeeping people, everybody around. You know, we're like a big family, and it's a really good environment to work in, and everybody works together with teamwork. You know, teamwork makes the dream work, and when everybody's working together hand in hand, things go better. And I felt like this is where the Lord's placed me. And, you know, I always try to pray and see where I'm supposed to go. And I feel like St. Elizabeth's it, because God knows the good work that's going on here and how we take care of our patients, and they come number one, and that makes a difference. And I've personally had that in my life, being put in the hospital at St. Elizabeth before. I've had A1 care as well. So I'm grateful to be a part and to be able to give back.
That's right. Our patients are always our top priority. So could you tell me what type of person would be interested in pharmacy and why they may want to consider the pharmacy as a career?
Yes, ma'am. I believe a young person getting ready to graduate high school that doesn't know what they want to do with their life, that just is trying to get a feel for, you know, careers out there, things they want to do that won't take up a lot of their time, that you don't have to go to college right now to do, which is really nice. You can do some retail if you want to, or just go in and job shadow somebody, volunteer, get your foot in the door. There's a lot of opportunities at St. Elizabeth, and there's a lot of pharmacy tech jobs. And I know personally myself, I didn't know anybody in pharmacy. I went to college for about 18 months, but you don't have to. I just chose to, because that was one of the things that was offered to me, and it helped me pass my certification test, which is really good too. PTCB, that's a really good site to check out, ptcb.org. If you're looking into taking the certification test, it helps you to be more valuable, helps you to be more skillful in your job. There's lots of roles in St. Elizabeth that you can do. There's Pyxisville, there's anticoagulation, the Coumadin Clinic. There's that, there's IVs, there's cancer care. I serve in all these areas, and I love it because I'm never bored. You never get stuck in a rut. There's always something, you know, awesome to do and something new to learn, which I love that because it keeps our mind challenged. So you can always grow. There's always growth opportunities here. I promise you, if you just give us a try, you won't be disappointed, because it's a really good place. And I love my job. I love the patients. I love the people I work with, and I wouldn't change it for anything.
Great. Thank you, Josie. So thank you all for sharing all of your stories. I hope this talk gives anyone interested in a career in pharmacy some insight into the many opportunities that we have here. It just keeps growing endlessly. I just hope that this talk provides somebody with the initiative to apply here, because we are always looking for great people to work. I hope you guys have a great day. Thanks.